Hi there, this is Amelia Hart, and today we're going to talk about an abdominal aortic aneurysm. So, what is an aorta? An aorta is a large blood vessel in your body that distributes oxygen to various parts of your body, including organs that are important and your legs. And so here you can see that I'm drawing all the blood vessels and the aorta under the heart. And so what is an aneurysm? An aneurysm is a widened area. And so an abdominal aortic aneurysm is when the aorta in the abdominal region is widened and enlarged. And this can be really dangerous and life-threatening because the walls are thinner and they could actually rupture and cause life-threatening bleeding. And what are the causes of an abdominal aortic aneurysm? One is hardening arteries. Another term for it is called atherosclerosis, where there's plaque buildup from cholesterol, and this can weaken the artery wall and cause it to stretch. Another is high blood pressure. The blood pressure over time can forcefully cause the diameter of the wall to be thickened. A third is blood vessel diseases. Certain diseases can cause inflammation, which can also thicken the diameter of the aorta and cause an aneurysm. And also trauma or infection can be a cause. And what are some symptoms? Some symptoms of an abdominal aortic aneurysm include back pain, stomach pain. Sometimes you may see a bulging pulse near your belly button, and you also may just not have any symptoms at all. Some risk factors of abdominal aortic aneurysm include having a history or being a current smoker, having a family history of aortic aneurysms, being 65 years or older, being male, or having your own history of aneurysms in other parts of your body. And so your provider, if they know about these risk factors, they may screen you and try to see if you may have an AAA. And so there's two ways to diagnose, either with an echocardiogram or a CT scan. The echocardiogram will not be as accurate as a CT scan, but it's usually used to follow the abdominal aortic aneurysm. The CT scan may be used once in a while to get an accurate measurement of how big the aneurysm is. So, if you were diagnosed with abdominal aortic aneurysm, now what? Oftentimes, the provider will do a routine echo or CT scans to follow your dilation, and they will measure the aneurysm in centimeters. If the aneurysm grows to 5.5 centimeters, the aneurysm may be operated on, and it also may be operated on sooner depending on your own history, such as family history of aortic aneurysm or your own personal history of having an aneurysm. And there's two ways to be able to repair an abdominal aortic aneurysm. One is a surgical repair, and the second one is an EVAR, which is a minimally invasive surgery without having to fully open up your abdomen area. Regardless if you have to have open surgery or you have a minimally invasive procedure, both outcomes will include having a stent graft placed in the aneurysm site to keep the aorta nice and small there and prevent future issues. While living with abdominal aortic aneurysm, prior to the repair, you should avoid strenuous activities. You should avoid smoking or using tobacco products. You should eat a healthy diet, and you should definitely keep track of your blood pressure and your cholesterol and make sure both of these are under control because these can worsen an aneurysm. If you continue to follow these aspects, you may never need a repair, depending on your own condition. And thank you so much for listening. This is Amelia Heart and Vascular Center, and I hope you learned a little more about the abdominal aortic aneurysm.